Okay, as I mentioned earlier, this is Military Dinner Table Conversations. I'm Jen Barnhill. I'm a columnist with military.com and also just a military family member myself. I have worked in this field, working as a volunteer with Partners in Promise, which is an organization that is dedicated to helping military kids in special ed. So military children and the medical component is something I'm very familiar with, but I really am here to learn more about what people are experiencing right now, not just historically. So with all that being said, I wanted to introduce and welcome Kara Oakley to the call. She is the guest today, and we're going to hear from her, learn a little bit about TRICARE for Kids Coalition and what they're hearing as from families and just within their organizations. And then we'll just jump right into questions. So Kara, I'll kick it over to you if you want to introduce yourself and share a little bit.
Thank you so much, Jen. I am Kara Oakley. I see a couple of familiar names and faces, so I'm always excited to have to see folks I've known, and I can't tell you how much I appreciate those of you who are just continuing to be advocates for your community and help share your experiences, because that also informs our advocacy. So I founded and chair the TRICARE for Kids Coalition a little over 10 years ago now. And it was around what I would call the seminal piece of federal legislation that examines how kids in military families receive care and supports and services. We called it TRICARE for Kids, and it required a SecDef level review of all the pediatric practices and policies, basically under TRICARE. And we branched out. We work on EFMP issues and things like that as well, but under the umbrella of kids' health and well-being. And so that just sparked so many wonderful connections. We formed the coalition to try to work around what we found were the gaps and opportunities for improvement that we had identified, and then that came back in these reports that were required by the legislation. So I think that's a good way to look at it: gaps in care and opportunities for improvement. And TRICARE is a system built on Medicare, which is a system for senior adults, not just adults, but senior adults. And so when I tell you there are gaps and big holes and gaping cliffs, you can probably and many of you have probably lived it as well. So it's a good insurance plan. They'll tell you it's not an insurance plan, it's a good benefit. TRICARE Health Benefit is a good benefit, but we are here to make sure it works for kids and their families. And you can't help kids without helping families, right? So it's important. Everything, kids grow and develop quickly. They have different kind of considerations than adults do in healthcare, and they are so dependent on their environment, schools, parents, their work, their living spaces. So it's all part of the health and wellness of kids. And we are here today to share anything. I can share with you what I am hearing and what I'm concerned about, but I specifically would like to hear from you all, obviously, about what you're concerned about and hearing, because sometimes by the time I hear about it and work on it, it's already been impacting families for years. A couple of things just to share with you about who the TRICARE for Kids Coalition is. It's made up of children's health advocates, some of them, and I won't get everybody right off the top because I don't want to keep talking, but it's the Children's Hospital Association, and that's where I came to this space 20-something years ago, is working on behalf of children's hospitals. The AAP, the American Academy of Pediatrics, the National Association for Children's Behavioral Health. So it's organizations like that. And then it's military family community organizations such as Exceptional Families of the Military, is well represented here today, wonderfully. National Military Family Association, Military Officers Association of America. Just really great organizations, all of whom have huge portfolios, but we come together around this space and we work really well together, and we've been so much more effective working together. And I just can't say enough about our work through TRICARE for Kids, but it's informed by hearing from the community and providers, because we can tell kind of both sides of the same story. Sometimes it takes longer to work through the provider side. But this is how we roll. A couple of things that you may have heard of that we've done, and we've really, sometimes I feel like I beat my head against a wall, but we have made a ton of strides. One of the most publicized ones, I think, was about 5 years ago, where we ensured through legislation that military kids have access to hospice care. Believe it or not, that was a thing when they're not in question anywhere in the rest of the healthcare system, but kids in TRICARE. And then recently, we were able to do some work on ECHO, which is the Extended Care Health Option Program. And one of the things that we did was increase respite care for families under that program from 16 hours per month to 32. So we doubled it. I'd like to see more, but we doubled it. Now I'm using that as an example of here's one of the things we run into. We have to keep the nose to the grind, because sometimes even when we pass legislation like that 3 years ago, it's not been implemented in policy yet. So we are out there every week for, talking to DHA, sending notices, getting members of Congress to say, where's our extra 16 more hours that we passed? So this is kind of how we pass legislation, but then we also have to make sure it actually works in implementation, if that makes sense. Jen, that's kind of me and what we do. I can share some of the issue areas I'm concerned about, or you can open. How would you like to go?
So this is a conversation. So the intent is for anyone who has something that they would like to share. That's the purpose. It's not for you to listen to people talking to you, really. And this can be from your lens. So if you're coming to this conversation as a medical professional who serves this population, please do feel we want to hear from you too. It's not just families. We need to hear from the whole entire community of support to understand what people are experiencing. So I launched a couple polls to see, number of children and level of need for individuals. It's interesting right now, and I'm going to end the poll. If anyone wants to answer this one, feel free to answer it now. Otherwise, I'm going to end it. But, as of right now, we have 50-50 saying yes, that they do have medically complex children, and 50% say no. And so I think that that's quite interesting to me. I would love to hear more from that different experience, that lens. So what are the complications of someone who has a medically complex child as compared to someone who maybe doesn't? So let's keep going. So let me share that. First thing, I'm going to ask another general question, which is going to be, what are your concerns? That is what we're here to talk about today. We have heard a lot about continuity of care, access to appointments, TRICARE coverage, the burden that is related to submitting paperwork, all of these things. What are you hearing? What are you experiencing? You can select as many as you want. If anyone wants to come off mute and share some of their experiences of what they're hearing, feel free to do so, or to pop in the chat if they have anything to share. This is a conversation and it's intended to hear from you guys. So does anyone want to come off mute and share of why they decided to join this conversation today? And I'm a reporter and I can sit awkwardly in silence for as long as it's needed.
Hi, this is Michelle Lynn. I can just throw some comments out.
Yes.
I just wanted this group to know that the National Academy of Sciences, Engineering, and Math is doing their study that was directed by the NDAA on applied behavior analysis, which is care for individuals with autism and children. And I have an adult son with pretty severe, profound autism, and he's benefited from that program. But the changes that they've made since 2021 have really limited access to care. I'm also a provider in that I'm a volunteer board member for an organization that provides ABA to military kids and others across the community. And TRICARE has put themselves in a position where they are the most cumbersome and difficult to deal with. So you're finding a lot of providers not taking TRICARE clients in my community, which is Colorado Springs, and that's across the country, though we haven't been able to grab that data. And so I just wanted you to be aware of that. And also, I don't know how many autism families would be participating, but I just wanted to let everyone know. I can try and share the link in the comments because they are taking feedback from anyone. And that feedback is open, so you can submit comments and papers. And again, that was directed, I think, from the 2021 NDAA that the National Academies of Science review the TRICARE benefit for autism, and they have some objectives. So I just wanted to share that, and that's why I came today. Thanks.
Thanks, Michelle. Yeah, and feel free to put any resources in the chat. I've had two of these conversations. One was on the status of forces agreement and one was on PCSing. And I've learned a lot in these conversations because of folks all coming with different resources and sharing them. And anything that gets put in the chat resource-wise will be included in the summary that I send out to everyone. Does anyone have anything to add or respond to Michelle's comment? And if not, I see someone named Rachel has raised their hand, and I would give you a chance to chat, Rachel.
Yep. So I actually wanted to join to talk about autism in the military. I'm a service member, so I'm staying off video. But I've had, as a service member, my son is 6, so this is all new to me. But it has been quite a challenging road, and there are lots of challenges being a military member and my son that have come into play. And I didn't know them all in the beginning, but now that my son has finally been diagnosed, they all make sense. So my son was enrolled in the CDC, but due to his behavior issues and sensory issues, he was getting kicked out almost daily. And they would call him a bad kid. So he would, and I have a job where I couldn't go home. So he would be at work with me all the time. And he has all these challenges. We've had to find different childcare and things like that. Sorry, it's just been really difficult and no one understands. So he went to kindergarten this year. And when we took him in for his kindergarten physical, the pediatrician, we talked about his behavior issues and things like that. And every other time I've talked to a pediatrician, they just said, oh, he'll grow out of it. He'll grow out of it. He's not on the scale anywhere. We can try and get you in to see a behavioral specialist, but it's a 12-month wait. So like there were no avenues as a parent to do this. And I don't have it, like both of us work. We're not stay-at-home parents. So this was very difficult. So finally, she addressed our needs. But she also said that TRICARE doesn't allow them to diagnose behavioral issues before they go to kindergarten. So like it made sense why they would just push us off until he started kindergarten. And then when I took him in for his kindergarten physical, it was like everything changed. But I needed that support 3 years prior to get him in for help. But they also didn't, like all they said was, oh, we'll put in a referral for a neuropsych eval. Well, that's not really the process. So we called all over town. No one had any openings. So we finally found a psychiatrist who took us in, and she walked us through the process. And she's like, a general pediatrician can't just make a referral for a neuropsych. You have to go see a psychiatrist first. And then they put you in with a neuropsych. Like there's a whole process, but no one walks you through all that. Like we spent hours on the phone trying to talk to people. I had no clue about ABA therapy. I don't even know what ECHOS is. I didn't know that there's a whole autism care program. Like these are all things that we have to research on our own. And EFMP, special needs coordinators, like none of those people talk to you about this stuff. I had no idea these resources were available. It's really challenging. And they also don't diagnose autism like right off the bat. It's multiple appointments. My other problem with this is my family is back in the States. I chose to come overseas and take an assignment because of my son's behavioral needs. They wouldn't diagnose him when I had to leave, but I knew he wouldn't thrive over here. So we decided to split the family up. So halfway through my assignment, I've realized all of this. I was home on leave and taking him to a lot of these appointments. I applied to come back home to help get him stabilized and in all these programs and things like that. And the military denied me. They said it was my fault because I chose to leave, even though he had challenges. But I didn't know he was autistic until halfway through. And once there's a diagnosis, like it changes everything that you do. Before you get that diagnosis, there's not really like, yes, we managed, but once there's a diagnosis, or like if someone starts tipping in the right direction, then you have all these appointments that you have to go through to try to help your family. And that was quite the burden on my husband after I had to return back overseas. And I am no longer able to participate in all of his therapy and treatments and things like that.
Thank you so much for sharing, Rachel. I know some folks plopped some information in the chat for you of resources that might be available. Can I ask a question? Is that okay? So my question, and this question is for you, Rachel, but for anyone else who wants to answer, is when it comes to navigating those early moments, those early diagnoses, where either did you go, where did you turn, or where would you have liked to turn? What resources would you have liked to see, maybe that you didn't see, that might have, in hindsight, given you a more smooth experience? And Rachel, you don't have to answer that question. I'm just kind of asking in general, where do people turn when they are kind of faced with the unknown? If anyone wants, I do see another person has raised their hand as well.
So she gave us the referral, and once the referral was approved, like we just called around town. And I also asked for a recommendation to put into my reassignment. And when I was updating his EFMP and things like that, and when I was talking to the pediatrician, I let her know about all of my challenges trying to find any office that would help me. And then she put me in contact with a special needs coordinator, but the special needs coordinator had done all the phone calls that I had already done. Mm-hmm. I just wish, like, I don't know if, like, I understand the pediatricians are really busy and they have to keep to their appointment schedule, but when you're dealing with special needs, like, I feel like someone should be able. They didn't give us any resources. I had to figure it out all on my own. And then even afterwards, the special needs coordinator didn't really help. She put in a favor to a psychiatrist and it fell through, and she never contacted us again and doesn't respond. No one helped, not even EFMP. Like when I reached out to EFMP to get because I needed my letter for a reassignment, and it had the autistic diagnosis in there that I just got. They updated it to show all that. They didn't bring up echo. Like no one talked to me about echo or any of those things. No one even let me know that these resources were there. This is just me going out and researching on my own. And yes, it would have been helpful if the pediatrician was like, here, please go down and speak to so-and-so, and they can help you. They've helped families out through this in the past. And that's just my experience, though. I don't really know who should have or what would have been helpful.
That's helpful in understanding your experience. I know your guest too, but I'm sure you have another name. If you want to come off mute since you have your hand raised, feel free.
Yeah, I can't figure out how to change my name. Shale Norwitz. So Rachel, I had the exact same experience, and it answers Ms. Barnhill's question, which is, so I was active duty service member. I was going to the CDC. They're in Colorado, and what do? They drop you off the edge of a cliff. They every day they call you, after something, they call you. You need to come pick up your son. You need to come pick up your kid because they're doing something. And I'll refrain from commenting on the lack of capability of the CDC to do anything effective, but I'll just say part of it's on them. But to answer Jennifer's question, where do you want to see services extended to? You don't want parents to be driven off the edge of a cliff. And so if the CDC is rejecting children by policy due to behavior, and you have multiple parents out there, whose first experience with learning that their child is different than their peers is by getting them booted from the CDC. You'd think there'd be some sort of on-ramp at the CDC for them to say, hey, you know, here's where you exit our program, but here's where parents like you
Here's where you
have
go.
entered into an alternate solution, right? Now, I don't have a whole lot of hope for that happening in an effective manner, just because I had multiple bad experiences from multiple CDCs and the lack of management, and whether or not the government should be having child care centers in general, I think is a bigger question. But you know, basically, to answer the question, everywhere where parents are are encountering their first experience with children, their first difficulties, that's where the on-ramps should be. So with your primary care physicians or with your pediatricians who are on base, if they don't have these resources available to say, hey, the minute the word autism or PDD-NOS or any kind of developmental disorder comes in, where's the on-ramp to these programs that Rachel's talking about? So it's real simple. You know, you begin at the beginning. Where are parents encountering this the first? So anyways, I really just wanted to say, Rachel, I had the same experience, and I'm sorry that you are experiencing that. I know as a parent who is also neurodivergent myself, you know, so I'm autistic. I retired from the Air Force. When things don't make sense, it's extra frustrating. So when you're a neurodivergent parent, you're more likely to have neurodivergent kids. And so now you're trying to navigate the system of autism knowledge and advocacy and childcare and access to resources. And it's extra frustrating to us because things that don't make sense, these unwritten rules that don't make sense, why do things not work the way they're supposed to work? They're extra frustrating to us. So I don't know if you identify with that at all, but that's where I'm going to leave it at.
Thank you so
Jen,
much.
can I?
Yeah, go for it.
Can I just real quick? I have a concern that I'm trying to really, I don't know, describe, nail down, what have you, that the trauma that families experience from repeated attempts at accessing care or inability to access care is something that we're going to need to worry about, focus on, understand better the impacts it has on families who, you know, do not have both. I think of it usually in terms of denials of care, but as I'm hearing your story, Rachel's story, it's also just where to go and not, you know, having no idea what to do next and what have you. So that is a denial of care or a lack of resources. So I guess what I'm saying, one of my concerns, and I think it's a long-term kind of concern, I don't have a very specific description of it for you or any solution, but I'd like for this group to think about it, is what do we do for families who are experiencing trauma as a result of their inability to get care for their kids in ways that are meaningful and effective for their families. So.
Thank you, Karen. It kind of leads me to another question that's not a poll question. So if anyone wants to come off mute or put their response in the chat, you know, it feels like this is a situation where, and this is based on my past research on this topic, that a lot of these issues, like when someone first starts, they go down a diagnostic path, for lack of a better phrase. It feels like it's the first time this has ever happened to anyone. Like that's how I'm hearing this. And I don't know if that rings true for the group, you know, but obviously the question I originally had was, where do you go maybe within the structure of the military? And maybe there's also another layer of that personal component. Like we know that we don't necessarily sit down and have discussions about your child's diagnoses. But maybe we should. I don't know. Maybe that would make it easier for you to connect. I don't know if that's been people's lived experience, and I'm would just love to hear from you all. Austin, would you like to share?
So I know for us, we face a new diagnosis, what feels like every month. And every time there's a new possibility on the table, the doctors tell us that well, we don't want to tell you what it could be until we're sure it's that. And then we walk into that appointment blindsided by what the new diagnosis is, and we're not given the time to prepare. So if I knew that X, Y, and Z was on the table, I could think about my questions for what that diagnosis could be, and then I could bring them to the table. But I feel like I'm probably not alone where we go to that appointment, we get a diagnosis, and they're like, okay, we need you to schedule a follow-up, and we'll see you in 3 or 4 months. And then we spend that next 3 or 4 months trying to navigate the system and figure out what our kids need, because we don't want to just sit around and do nothing. And there's no one there to hold our hand. And the questions we probably would have had to be able to ask, we didn't have in that moment because that diagnosis was so shocking. Maybe I'm wrong, but that's how I feel every time there's a new diagnosis laid out for us.
Thanks for sharing that, Austin. Anyone else have anything else to share before we kind of launch into a new topic? I would love to hear from anyone who's had either very, I guess the word timely, or had referrals work out really well. Have you had a good experience where you moved to a new location and you were welcomed, open arms, saw care right away? What was that? If someone has that experience, I'd love to hear from them. And if they, even within a delayed period, I would love to hear a little bit about a good experience, because I think we often hear that there's a lot of delays in care, but I would love to hear a good experience. And then alternatively, after Rebecca, if you want to share, feel free to do so. And then if you have an alternate experience, someone else, feel free to raise your hand and you can share as well. Go for it, Rebecca.
Hi, so I did have a good experience, but I would like to caveat that with, I like to credit myself with that experience because I did a lot of research, and my husband would have turned down the assignment had we not found the right medical care, which would have been punitive for him because it was a nominative assignment. So which not every family will do, but I do the research. When his list of assignments come out, I do all the research on the top 10 places, and we try to focus our efforts on him getting to those places. And then when a possible assignment comes down, I call around asking the specialists, asking the wait lists and everything like that before my husband says yes. And this is not a position that everybody's been in, but it did make my transition pretty good to where I was able to get care right away for all of my son's specialties. But again, I feel frustrated because, there are people in positions. My frustration point is that the people in the positions that are paid to do this to help us, I'm not getting any help from specifically.
Yeah, and that sounds like similar to what others have shared, that there's a little bit of gap in that handoff. That seems to be, is that what a good summary, Rebecca? Yeah, okay. Thank you. Michelle, would you like to share?
Sorry, sure. Yeah, I just wanted to recommend or switching to TRICARE Select, which I don't know what it was called Prime before in the years ago, but I did that really early on with my family, and it was very significant in helping our ability to just go to providers without referrals. Again, you have to pay a little bit more, but again, especially if you have working spouses and family, that's definitely an investment to make. And you do have to navigate it yourself, but again, you do have the power then. And so that is a great benefit. And I would say that in the civilian community, there's terrible systems navigation here in Colorado as well. But so I think more just letting people know this is on you, unfortunately, is something that would be helpful, and having navigators who can actually tell at least direct you into those off ramps. I really like that language of, this is what you need to do. But our EFMP coordinators aren't doing that, and it's sad. So I just wanted to throw that out there. I'm sorry.
Thank you, Michelle. So sorry for the out of order question of length of service. I wanted to kind of pop that in there, but we don't need to address it. It's more just for context of your lived experiences. So as far as delays in accessing care, we have heard a lot about that nationwide, right? There's a provider shortage. I'd love to hear from someone who has experienced that. If you have a story that you would like to share, or whether that's the communication, like addressing the communication you received or a lack of communication, how are you, like, for example, I have noticed that referrals with TRICARE for mental health care providers allows you to change providers in the system online, but it doesn't mean that that corrects the problem of a lack of availability. That's an example of one update that has maybe been implemented that hasn't necessarily achieved the desired result of getting care to families. So does anyone have any, we asked Rebecca for the positive, does anyone have any negative experiences in the access to care or continuity of care?
I can go ahead with that, I guess. So we've had issues with that when we first got here with my daughter being diagnosed with ADHD and emotional issues, and getting referred to a child psychologist and psychiatrist to be able to get medication and therapy, because if they were going to put her on medication, they were going to also require that she have therapy appointments. And when we first got here, shortly after she got diagnosed, we didn't have an option on base, and we live overseas at an Oconus location. So it was a little daunting to us, because you don't always know, are you going to someone who is a local national and has the same type of care that you're used to? Or are you going to an American clinic, or one that's more Americanized, I guess? And we were able to go to a German clinic, but we saw an American spouse who was married to the military. So it did work out, but then she PCSs. And we weren't there for very long. And then we didn't have an option of who to go to, because there was nobody on base that they wanted to send us to. There was a provider, but they didn't want to refer us to them because we're Air Force and it was over at the Army hospital. So we had to wait, and we did not have care for a while, and we were just seeing the pediatrician. And it's a little upsetting when the pediatrician says, well, I'm just going to continue with the medication that your child is on right now, but I don't have any experience in it. And if it stops working for them, or they need to change doses, I don't know what to do. And when you're like new into this journey of therapy and medication and everything else, it's very upsetting, I guess is the word to say. But we were finally able to get over to the Army hospital, luckily, because the psychologist that my daughter was seeing knew the person at the Army hospital and really advocated for our child to get over there. So we were able to do that, and we've been seeing them for a few years now, and it's been great. But then we had a new aspect of care needed, where my daughter came out to us as trans. So she's having to deal with having therapy for ADHD and anxiety and PTSD, but now we have a new aspect of gender affirming care, which he says he's not well versed in. And we tried to go to the Air Force clinic to the person who is specializing in gender affirming care. But at first we wanted to stay with our doctor or our psychologist because of continuity. And then it was just too much to focus on at one appointment. So we asked to move over to the other doctor for just the gender affirming care part. And then our healthcare system changed. They were putting into the new Genesis healthcare, and they were not allowing anyone to take new patients. So we had to wait, and that was back in July. And we still don't have any hope, I guess, of moving over there, because it's still, as they say, working out the bugs. And there's limited appointments now, and they don't want to take on new patients. So a friend luckily was able to talk to the doctor at the Army hospital who does gender affirming care, the one and only, who's a pediatric endocrinologist also. And we're trying to get over there. We put in for our PCM change, but the reason we didn't try to begin with was because that person was also supposed to be PCSing. So they put a hold on them getting new patients, but then they got extended. So now they're finally able to take some new patients, but they even have other patients who they saw, but people are trying to stay here to continue with them, but they can't because they're going to be getting out of the military. So they're just trying to see them until they can transition over on the economy. And it's frustrating because nobody can tell you what route you're supposed to be going on, what steps you're supposed to be taking. You just have to hope that you know a mom or someone who will give you guidance, because your doctors won't. And they just say, I don't know anything about it. I can't help you. They're not going to say, this is what you need to do. They just say, that's not on me. That's not my specialty.
I'm so sorry to hear
And you
that.
just have to pray that someone will like reach out to you.
Michelle, do you think if you had a telehealth option, did anyone speak to you about any of that? Or do you think if you had something like that, it would have at least bridged a gap for you, or that you would have been willing to try that?
I mean, yes, because I do know that her speaking to someone is very, very helpful. But now we have the problem of, if we can't get switched to this doctor, what are our options for her to get hormone therapy? I mean, she's just turned 15. You don't want to rush into anything, but you're also racing against a puberty clock that makes their gender dysphoria worse and their mental health worse. And then you have a doctor saying, I'm not going to give you referrals unless her mental health is okay, unless she's stable. But then she's not being given access to care, and it makes her mental health worse.
So sorry,
And
Michelle.
all you're doing is trying to be a good parent and not lose your child. Because with my own child and with other parents in our family group that we go to, we all have stories of worry with our children that we're going to lose them, because there's been times that they've said things or they've done things, and then your doctor says they're not stable, we're not going to let you do this. But then we don't have access to care to keep them stable.
Sorry, Michelle. I thank you so much for sharing that experience. I really appreciate that. I know, Kathy, that you might have heard some similar stories in your work with MMAA, but if you wanted to share.
Yeah, not why I originally raised my hand. Can you guys hear me okay?
Yes.
Yeah, not why I raised my hand, but I am so sorry for what you are going through, Michelle. And you hit the nail on the head. It should not be another parent that steps in to give resources. It should be the doctors. But let me be that parent today. I put my phone in the chat, like, call me, call me, call me. I run the Mill Pride group that just works with military families. Sorry, I've got
I'm distracting you with poll questions. I'm sorry.
The Mill Pride group is nothing but moms who have faced the same challenges that you have. We will brainstorm all the options. We can talk to the endocrinologist at Walter Reed and do telehealth as a stopgap. That telehealth can work with your primary care provider to coordinate health until you can get into who you should be seeing. We can come up with options. And even if you just want to cry on the phone, I will cry with you. Like, I'm so sorry for what you're going through. And unfortunately, so many people have been there, especially when we talk about the limited specialty care appointments, right? Like, I think there's 5 pediatric endocrinologists for all of the military. And like, one of them just retired, which it's unacceptable, right? Everybody needs endocrinologists, not just trans and non-binary kids. So, yeah, so more access to specialty care, I would say. But the reason why I raised my hand now seems unimportant compared to what Michelle was discussing. But I was going to say, when my daughter went away to college, she was about 2 hours away from us. And she has lots of medications she needs management on. So she needed to have a primary care provider locally. And so we ended up switching her to TRICARE Select. But no one in the entire Richmond, Virginia area was taking new primary care patients. No one that used TRICARE Select was taking primary care patients. She had no access to medical care locally for more than 6 months. And she was needing refills. And I didn't know what we were supposed to do when you just literally call everyone on the list and you can't find a doctor. It was horrible. And then the second aspect of that was that when it came to getting psychiatric help or psychology, that was an even longer wait. So that was incredibly frustrating. And then I don't know if it's ever been a topic, but like the ghost network of Humana service providers, like they don't exist. You call them, they've moved. And I ended up having a conversation with the Humana guy as they were going down the list with me. And I was like, nope, I've called them. They don't exist. That company closed, blah, blah, blah. And he eventually said to me, well, it's not my job to maintain the list. It's not our job at Humana to maintain the list. That's the service provider needs to tell us when they're no longer taking, new patients, or they're no longer a provider and stuff like that. So it was another same situation where it was like, well, it's not really my problem. But they boast about having those lists available and look at all our providers, but they're not real. It's not a real list. Sorry, I went on to.
No, that's totally fine. Can I ask a question, and then Kara, if you want to say something? My question would be, for those who kind of have experienced something similar to what Kathy has shared, have you ever experienced a situation where that provider maybe is taking patients, just not TRICARE patients? Has anyone experienced that? Because I don't know how they would code it. People have shared with me, and I just wonder how prevalent it is that individuals have maybe taking TRICARE, but because of the way the reimbursements work and the delay in payments, that they can't afford to only take TRICARE patients. So therefore they have to diversify their clients, and therefore they might be accepting patients, but not TRICARE patients. Has anyone experienced that? Rachel, I see you unmute, or you raised your hand in Austin. Rachel first, then Austin.
They haven't said they're not taking TRICARE patients right now, but even with pharmacies and stuff like that, medications, I know someone brought that up, but calling around, there are a lot of people. The list that they give you is, yeah, you just call around and most of them are not taking patients, or they no longer take TRICARE. Same thing with pharmacies. You call around trying to find a medication for your kids, and either they don't have the medication or they don't take, a lot of them are like, we don't take TRICARE anymore. It is very challenging.
And before we go to you, Austin, if there are any providers on this call, even if you don't want to go off mute and chat, if you want to put in the chat, possibly like, is this something you're seeing outside of this military space? I'd love to hear from you as well. Or if you're connected to that provider side, I'd love to hear that perspective if you would be willing to share it. Thanks, Rachel. Austin?
Where's that?
So I've had somewhat similar experience, but I'll have a company that takes TRICARE, but only for some things. So some things they'll take TRICARE for, other things we don't take because they don't reimburse well enough. Or we do take TRICARE, but we're not taking any TRICARE patients now because they haven't paid us in over a year. So I'll get like those two things. Yes, we take TRICARE, but we're not taking anybody right now. When my daughter needed rehab for her stroke, the pediatric rehab facility that was down the street from the hospital said, we do take TRICARE, but they haven't paid us in 24 months for a single patient, so we can't take her. So she had to go to a different facility, and DME companies are always telling me, we could take you for this item, but that item we don't get reimbursed enough for, so we can't provide that to you. You have to go somewhere else.
So, when it comes to, and anyone who has heard of that particular topic where, I'm going to say it in a way that I would probably think through in the future and not say it this way now, but it's almost like you're being used for collections, like a little bit, to be like, okay, we're not, then you go and you complain, possibly, hey, this is a problem. I don't know. This is interesting. I've not heard of that before. Thank you, Austin. Did anyone have anything additional to share related, Kara?
I just want to say, from the provider standpoint, this is a real thing. And I would say it's probably mostly these practices, especially when you get into mental behavioral space, and some of these others are hugely busy. They're overwhelmed. And if you have a choice to pay, to have a choice to have a commercial payer and, a checklist of 5 things to check off for each kid versus, a ream of paperwork and somebody that doesn't pay as the payer, it's just a business decision, I think. Now, this doesn't happen with hospitals. I want to be real clear. It shouldn't be happening with hospitals. They have different standards of mission and serve, and who they take and can't, and who they can and can't take if they're network hospital, things like that. But for provider practices, this is real. They have to manage basically their business, because that's what they are. Most of these practices are businesses. It's not like they're hospitals and they're not for profits or something like that, that has a mission statement to the community. And so I think this is a very real, I know it is a very real thing. I just want to say it's not, it's not unheard of, and it's not even unusual. This has been going on. It's just that we see it now so much because there's so many provider shortages and so many other difficulties in accessing care, just compounding, I think. So we see it more, if that makes sense.
Got it. Yeah. It's, because of the environment, it's this is true of many military conversations that we have. It's like elevated, that the concern becomes elevated because of all the layers of complication. Michelle? I'm sorry, Karen. Did you want to?
Just to finish that thought, there's literally a quote that we pull up every so often from the director of DHA from a few years ago. It's not the current director, but it was the director at the time, who said, most of our providers are serving patients out of a sense of patriotism because our reimbursement, I'm paraphrasing the quote, but our reimbursement rates are so bad, a lot of our providers are seeing patients literally out of a sense of patriotism. And while that's laudable, it's not sustainable.
Yeah. I know, and we'll go to you, Michelle, in a second. I know that there are providers on this call, and I would love your thoughts offline if you're willing to share those on this topic. Michelle?
Yeah, I saw you put the pharmacy question up there, and that has been, I think, the past 2 years when they cut almost all local small pharmacies out, the reimbursement rate has been so low. So my son has complex needs, and I can't change his generic formulation or he would have seizures, So luckily my pharmacists work with me, and I ended up just paying out of pocket because it was too hard. There was no way I could go through Express Scripts because they would not give me the same generic formulation. So, and also an issue with my husband, who unfortunately had a heart attack this year. I had to pay out of pocket for a $500 medicine because he needed it right then. And again, just totally non-responsive, that you can't use a local pharmacy to get, Walgreens is the only, and they were a dumpster fire. Just very frustrating. The pharmacy benefit has really gone downhill in the past 2 years. And so luckily my son takes generics, and they're like $20 to renew them per month. And I've just decided to suck that up. So anyway.
Thank you for sharing. So I have a million other questions, and I know I want to be respectful of we only have a few minutes left on the hour. So I kind of want to leave it open. Does anyone have any topics that we haven't covered? Because I think we've tread on a lot of the same things we've heard before, but are there other things that you're experiencing, either as a provider, as a family member, or wherever you sit in this space? Amanda, would you like to share?
Yes, thank you. I'm not sure. Honestly, my husband is on here as well, so he might be able to talk to the subject a little better than I am able to. And I apologize, I'm still in my PJs, so I really don't want to be on camera. But the struggle for us is our child was finally diagnosed with dyslexia. And no one really wants to recognize dyslexia. TRICARE definitely wants to say that dyslexia is a learning disability, and they don't cover learning disabilities. They cover developmental delays or disabilities. And I'm probably using delay and disability wrong here when you actually get into how they write it out. But our son, if he did not also have a speech delay and ADHD to help us with the therapies that he needs, we would have to come completely out of pocket for everything. And I said that he was not medically complex. And I think that definitely depends on, what your definition of medically complex means, but he could use multiple different kinds of therapies to get him on par with his peers that are being completely neglected and overlooked, or even programs that if we could get reimbursement for, that we could have in our own home and not have to depend on a specialist to provide for us or a therapist to provide for.
Yeah, well, thank you for sharing. I know there might be others on the call who have insights into this. I know that state to state, dyslexia is seen differently, and the care that individuals that receive in schools varies as well. So I know that's a huge challenge when you're PCSing to different locations to maintain that quality of care in the school setting and outside of the school setting. Anyone else have anything that they have experienced related to accessing care for your children or in the communities that you serve that you'd like to bring up? I have a few more questions, but I want to make sure to give you all the opportunity to share. If not, you are always welcome to email me. If you don't feel like going on camera and sharing, you can send me an email. I'll respond to the email I sent earlier today. And I believe you have Kara's as well if you want to reach out to her. But Austin?
So to Kara's question in the chat about being pulled back into the specialty care, to the MTS for specialty care, I know I posted at the very beginning, like Walter Reed is creating these clinics, and the clinics don't actually have pediatric providers, but they're recapturing our kids and assigning them to like pediatric dermatology, but it's all staffed by adult dermatologists. And I talked to another mom whose kiddo was pulled in for surgery, and he's always been seen at Shriners, and they were recaptured, and same thing, it's an adult surgeon. So I don't know if it's just Walter Reed, but that was to answer Kara's question.
Thank you.
Right. Kara, do you have any questions that you have for the group? I know you put that in the chat. I want to make sure you have an opportunity to anything to share. Otherwise, I'm going to we can keep going if people really want to keep going. But I definitely want to be respectful of everyone's time because we've talked about this for an hour, and I think there's 100 other things we could talk about. Kirsten?
Just a quick question to the comment about Walter Reed, because I'm working with a family who's going to be moving there soon. When you asked the provider, were they honest about what if they had pediatric training, or how did you find that information out?
Was that to you, Kathy? Because you were talking about Walter Reed. Sorry, I assume that.
Austin.
Or Austin, I forget.
I don't know if the person left.
Yeah, I think
that was for Austin, the dermatologist.
It was Austin.
Oh, Austin. Okay, I'm sorry. I'm getting confused between the different. Sorry, I thought you were saying that you could set someone up with telehealth at Walter Reed, so that's where I was getting confused. Okay, sorry. Austin, sorry. Do you have any insights to that question?
I'm so sorry. I stepped away because a kiddo came and got me. Can you tell me the question again?
I can say it again. So how did you find out that the dermatologist wasn't pediatric trained? Were they upfront with you if you asked, or did you have to do your own research?
So they couldn't figure out what was wrong with my child and offered me a referral to Children's National. And I said, well, I don't want to go to Children's National. You've been amazing. Let's keep trying to figure this out. And he's like, well, I can give you a referral because I'm not a pediatric dermatologist. None of us are. And that's what then made me say to my friend when her kiddo got recaptured from Shriners, because that's where he went his whole life. I'm like, ask them if it's an adult or a pediatric surgeon, because she said the surgeon had never done the surgery that her child needed. And when she asked, it was an adult surgeon. And that, like, that's not something they're telling you, but she said, like, are they a pediatric specialist? Are they a pediatric surgeon? And they told her no. And that's the same thing dermatology told me, because he was trying to be kind and say, like, just, I want to get you out of here because he was going TDY. And he's like, I don't want to hand you off to a friend, because he knew they couldn't do what they needed to do. So no, they're not being upfront. And they call it, like, if you are like, I need to book an appointment for my child, they're like, oh, we need to book you in the pediatric dermatology clinic. Literally, they call it that. And it's not staffed by a single pediatric dermatologist. And apparently the same thing, they're creating this surgery clinic for pediatric patients at Walter Reed. And the red flag, I think, is that these clinics are not housed in pediatric specialty. They're housed in the adult clinics instead of in the pediatric wing.
That's super helpful because I have a family getting ready to PCS to the Walter Reed area. And one tip could be, you could always ask the provider, how many procedures have you done like this? Or you could say, how many kids have you seen with this skin condition? But I guess you can see if they're getting a little nervous, that might tell you something.
Well, I think the concern is that if they are recapturing the kids back into the system, it's going to be difficult to have a choice. This is a stated goal to bring more people back into the direct care system, which is fine if the providers there are the appropriate providers for kids. But otherwise, I have concerns.
Is there a way to kind of, that person, and this is me just not knowing, you had that person be forthright and they shared that they could give you a referral out. Like, is there recourse? Like, where would you go if that was not an option provided to you? Like, what would that look like if you were to have just been like, that's or your friend, the surgery? What would the scenario look like? Is there a way to move forward?
So I asked her that. I'm like, let's go through this process. So they told her she could have a second opinion, but the second opinion is not going to be a refer and treat. It's only going to be a consult. So she could go to another doctor outside the MTF and have a consult on what the plan of the MTF doctor is, but the treatment would still be held to the MTF. And that is pretty typical when you get a second opinion. And sometimes when you ask for a second opinion, your second opinion actually occurs in the clinic in the MTF you want it, because we've had that happen with my little girl as well. I'm like, I don't feel comfortable with this doctor's plan. And they're like, okay, we're going to go knock on the door next door. And that's your second opinion. But that's really the only recourse, because they have the right of first refusal. I know I fought over the whole dermatology issue because I didn't take that referral. And now she's stuck there and her dermatologist is gone and I can't get anybody to see her because they said she's too complicated.
Okay, that's interesting. I've not heard of how second opinions work within the military system. Thank you for sharing that. I'm definitely interested in learning. I have more research to do. Kathy, you want to share? And if anyone needs to jump off, that is absolutely okay. I will be sending a summary. No, you can hop off in the middle of the conversation. That's fine too. Go for it.
Yeah, I apologize in advance. I don't want to derail with my specific soapbox, but I did want to say one other aspect that was brought up was the suggestion by the behavioral health provider that gender affirming care should be delayed until other mental health issues were resolved. That was the suggestion by Michelle's provider. And I just want to say that, like, that's really not best medical practice, because what we find in practice is that so many behavioral health issues are completely resolved when the gender affirming care comes in. So like the doctor's suggestion to delay that like really goes against best medical practice. And that makes me very angry that that's happening from a military provider. So I couldn't get off without saying that. And again, just if you want to talk about it on the phone, we can help brainstorm some solutions. Happy to talk. And that's it. This was really great. Thanks so much, Jennifer.
Thanks. Yeah, it makes me wonder like what other diagnoses or issues would be waiting for a mental health care clean bill of health, so to speak. I don't know
Exactly.
that I've heard of.
Exactly.
I don't know that I've heard of any, but I'd love to be to learn more. Well, I'm gonna turn off the recording and say goodbye officially, but if anyone wants to stick around and ask questions, we'll be, available. But thank you everyone for joining. I really appreciate it. And feel free to shoot me an email if you have any questions or would like to, add any additional information. I will summarize. So if you do email me, please let me know if that's something you're willing to let me include in the summary. You just didn't feel like doing it on camera. Please indicate that. Otherwise, this information is going to be shared and because we want to learn from it. So thank you again. I appreciate you joining.